we'll learn lots of the things from Abigail, and this podcast would be the massive learning podcast for the new and the freshers, especially from the mental health.
When I came to America and learned about the different type of psychiatric and mental health conditions that affect individual, I made it my mission to certainly educate myself and hopefully help other people in the same situations. I have been a nurse and for about 15 years and have been practicing as a nurse practitioner for over 5 years now.
As I have been into the education industry, right? So I deal with youngsters and teenagers as well, and mostly I'm in 18 to 25 bracket. So what happens most of the time, they fall in love actually, and when they face the breakups, so they become, sounds like what I say, a very crazy or like a moron. And they ask me, sir, my life ends up and I have no goal. So do you deal these kind of the patients as well? And how do you treat that?
That is a good question. There's this saying that every doctor has their own doctor, right?
I have done many podcasts, online and on-site podcasts, but in this podcast, literally I'm enjoying. And it seems as if this is gonna be, more 2 to 3 hours podcast as well, because your energy is attracting. That's amazing.
I think depending on the cultural background that you come from, mental health is not very much talked about or encouraged. I know, like I said initially, that I'm from Ghana. Well, people are not very educated on mental health. So depending on where an individual finds themselves, I would say that in America, the stigma and the barriers to mental health has significantly been reduced based on the trending approaches that are currently in mental health and also in psychiatric care. However, not everybody are privileged or fortunate to have those type of access to care. So for some cultures, they believe in maybe a naturalistic healing, psychic approach, religious healing or miracles. But I do think that it very much is based on where the individual are located geographically.
And again, what was your why? What was your why?
So my why was to build more flexibility for me and my family.
So I would say he is not an entrepreneur, but a serial entrepreneur.
Serial entrepreneur, yes. Providing the care that I think I am different in the field of psychiatry. Not everybody is an Abigail, not everybody is an Abby, right? So, and not every practice is mental peace psychiatry. I think we are doing wonderful things in the community and all throughout the United States.
Great, and for this mission, Abby is going to recruit and hire many mental health nurse practitioners. That the person should be crazy enough to work on and to be the part of this mission. So you're open to contact her, all right?